In the previous video, we looked at an essay by Kai Nielsen. Nielsen had argued that society should provide healthcare for everyone, whether they can afford it or not, and secondly, multi-tier healthcare systems are immoral. In other words, everyone needs to have access to the exact same type of healthcare. If anyone has access to a greater tier, a higher tier of healthcare, there's something wrong with that. Today, though, we're looking at an essay by Tristram Engelhardt. Engelhardt is basically going to argue the opposite of both of Nielsen's claims. So for our purposes, Engelhardt holds that individuals do not have a secular moral right to healthcare, and secondly, creation of a single-tiered healthcare system is morally wrong. So not only is Engelhardt going to try to show that there is no such thing as a natural secular right to healthcare, but he's going to argue that the type of healthcare that Nielsen is defending, there's something actually morally wrong with that. So Engelhardt thinks that there needs to be an allowance for multiple tiers of healthcare, specifically where people with resources can pay to get better healthcare if they want to. So I'll talk about both of these claims in turn. We'll spend most of the time looking at Engelhardt's argument that there is no such thing as a right to healthcare, and then we'll move on to his discussion of single-tier healthcare versus multi-tier. Regarding the first claim, Engelhardt writes, "A basic human secular moral right to healthcare does not exist, not even to a decent minimum of healthcare. Such rights must be created." It's really important to emphasize the word secular here. Secular space is supposed to be this common area that everyone shares, regardless of what their worldviews are. So by saying that there's no such thing as a secular moral right to healthcare, Engelhardt is saying there's no way to defend the idea that there's a right to healthcare independently of one's worldview. So think way back to our discussion of principlism. We talked about Beecham and Childers' book, The Principles of Biomedical Ethics, and defenders of principlism like Beecham and Childers tend to say things like the principles that they come up with, beneficence, non-maleficence, justice, autonomy, these are supposed to be principles that everyone can agree on regardless of their worldview or religion. Engelhardt rejects that view, though. When it comes to the secular space, this conceptual space that everyone is supposed to have in common regardless of their worldview, he thinks there's not a lot of content there. So just take justice, for example. Engelhardt is going to argue that there are a lot of different ways of understanding what justice is and what it requires of us. If that's right, if there are lots of different accounts of what justice is and what justice requires of us, then when you tell somebody you should act in a just way or you should promote justice, the natural question that arises is, which justice? Whose justice? Which idea of justice are we talking about here? For example, justice might be about not taking from people things that they own, so not seizing the resources of people who actually own those resources. This would be a kind of non-interference where justice is about not interfering with people's lives or not taking stuff away from them that they rightfully own. Or justice could be about distributing resources. So you might think that justice is about trying to distribute resources like food, shelter, water, money, whatever, across a population in an even sort of way. But these two conceptions, justice as non-interference with property holders versus justice as distribution of goods, these are two different sorts of things. But because there are so many different views of what justice is, this is why Engelhardt says loose talk about justice and fairness in healthcare is morally misleading, because it suggests that there is a particular canonical vision of justice or fairness that all have grounds to endorse. In other words, when an author says you should endorse universal healthcare because that's what justice requires, that's relying on a very particular account of justice. And it's treating that account of justice as though it's universal, as that it holds for everyone, that everyone agrees on it. And Engelhardt's point here is that there is no such account of justice. There's not a universal account that everyone buys into. There's going to be lots of variations about what justice is and what it involves based on your moral worldview or sometimes your religion. So if you think that justice is about non-interference, for example, where we don't take away from people their property that they own, then that doesn't have anything to do with distributing to people who have needs. Whereas if justice is about trying to meet the needs of everyone equally, then that might involve taking resources from people who have resources so that we can give those resources to people who need them. Even when it comes to distributive justice, so trying to distribute our resources in a fair way, there are a lot of different proposals for how to do this. We might, for example, distribute things evenly in that every person in society gets the exact same thing. So if you have 100 people in your city and you have $100 to give out, every person gets $1. This would be giving everyone exactly the same thing. But distribution might be done on the basis of need as well, where people who have greater needs receive more, people who have fewer needs receive less. So already, whether we distribute resources equally or we distribute resources based on need, these are two different accounts of distributive justice. We could also say that resources ought to be distributed based on merit, where you have to earn the resources that you're given. And then the people who have earned the most receive the most, whereas people who aren't working as hard, who maybe earn less, receive less from society. So there's lots of different proposals regarding how to understand distributive justice. And this just goes on. There's tons of ways of understanding what justice is and what it involves. So when someone says you ought to endorse this particular healthcare system because that's what justice demands, the right question to ask is, what is justice? Which account of justice are we talking about? And this matters because different communities or different individuals might have different conceptions of justice, and that affects what they think justice requires of them. And so when arguments are made that a particular form of healthcare ought to be endorsed because that's what justice requires, we need to get clear on which account of justice we're talking about. And remember, Engelhardt is saying that there's no natural secular right to healthcare. That is, there's no way to establish that people have a right to healthcare independently of a particular worldview or independently of agreement. So when it comes to the secular space, how do people with different worldviews, different accounts of justice, different ideas about what the demands of justice are, how do they come together and work together in a society? And Engelhardt's answer here is through agreement. If these diverse groups get together and decide they want to create a right to healthcare, that's fine. They can do that. But the right to healthcare doesn't exist before the agreement occurs. The right to healthcare is grounded in some sort of mutual agreement between these differing parties that make up our society, but there is no right to healthcare that just exists independently of contractual agreement. And that's true even if there are particular worldviews that maintain there is a right to healthcare. So you can have one worldview that says there is a right to healthcare, another worldview that says there's no right to healthcare. How do those two groups interact with one another? And the answer is they have to come to some sort of agreement. Otherwise, one moral community is just going to be trying to force the other moral community to live according to its principles. So what Engelhardt is talking about here is there's no right to healthcare that exists independently of one's worldview. Some worldviews hold that there is a right to healthcare. Some worldviews hold that there's no right to healthcare. And if we're going to establish a right to healthcare in our society, which is made up of people of all these different worldviews, it has to be done through agreement. It doesn't just exist by default. Now, all of that has been a pretty abstract discussion of the first claim. So the first claim is that there's no secular moral right to healthcare. To better illustrate, let's just talk about an example. Imagine that Bob needs a liver transplant to survive. He's not going to last much longer. He needs a liver transplant sometime in the next week or two. It turns out that his neighbor Sue is a perfect match for him in terms of being a donor. And so Sue could give up a lobe of her liver, and let's just assume that the surgery for Sue would be perfectly safe. There's really no risk to Sue at all here. So Sue could give up a lobe of her liver to save Bob's life. Bob is going to die unless he receives a liver transplant. But as it is, Sue just doesn't want to donate a lobe of her liver. So Bob needs a particular resource. Sue could donate that resource to Bob to save his life. And the question we should ask is, can society force Sue to give up a lobe of her liver to save Bob's life? After all, Bob has a healthcare need, and if it's society's job to meet the needs of everyone, then what's stopping society from forcing Sue to be a donor here? Suppose we believe that the demands of justice are that everyone's needs are met. If that's right, if that's what justice is about, then Sue has a kind of obligation. Justice demands that she donates a lobe of her liver, whether she wants to or not. But the question I want you to ask is, can society force Sue to donate here? My assumption is that a lot of viewers are going to think society doesn't have a right to step in and force Sue to be a donor. That is, society can't force Sue to donate a lobe of her liver to save Bob's life, even though Bob needs that to survive. So Bob doesn't have a right to just take a resource from Sue, and society doesn't have a right to step in and force Sue to give up this resource either. So we might put this in terms of a general argument. First, if to meet his healthcare needs, Bob requires something that belongs to Sue, it does not follow that Bob or even society may take that resource from Sue. Just because someone needs something, it does not follow that they can simply take it. So just at a very general level, there are going to be people who need healthcare but don't have access to it. There are other people in our society who have a lot of resources, and in fact so many resources that they could provide for the needs of those who do have healthcare needs. So those who have resources could give them up to provide for the needs of those who need resources. That doesn't mean that society can take that wealth in order to provide for the needs of people who don't have access to healthcare. Or just very simply, just because you need something doesn't give you the right to take it. Just because a person needs healthcare, maybe they even need healthcare to survive, that doesn't give them an automatic right to take resources from someone else to provide for their healthcare needs. So we can agree that there are a lot of people in our society that need healthcare, and there are a lot of those people who don't have access to it either. But they don't have a right to just take resources from other people in order to gain access to healthcare. That would be stealing. On the other hand, though, there could be a right to healthcare if our society gets together and agrees to create such a right. So we could create some sort of system that does provide healthcare for everyone, whether through taxation or some other process. But before we create a right to healthcare, there does not exist a right to healthcare. That's Engelhardt's main point here. So the right to healthcare, if it exists at all, it has to be created. There's another way in which we can make sense of Engelhardt's first claim. So he distinguishes between a natural lottery and a social lottery. The natural lottery is concerned with changes in fortune that result from natural forces, not directly from the actions of persons. When you think about natural forces, you can think about disease, genetic disorders, natural disasters. So for example, somebody might lose their home and all of their belongings in a tornado. That's a natural disaster. That's not caused by the actions of any person. Similarly, when it comes to lots of disease and cancer and genetic disorders, those aren't caused by the actions of people in many cases. And so when these bad things happen, but it's really nobody's fault, nobody can really be held responsible for what happens. When it comes to the natural lottery then, Engelhardt says, the circumstance that individuals are injured by hurricanes, storms, and earthquakes is often simply no one's fault. Furthermore, when there's no one to blame, no one may be charged with responsibility of making whole those who lose the natural lottery on the ground of accountability for that harm. What this means is, if somebody loses the natural lottery, they develop some sort of disease or cancer, or they lose their home in a natural disaster, because nobody is at fault for what happened, nobody can be held responsible for fixing the situation. So if nobody caused the tornado that destroyed somebody's house, nobody is responsible for helping that person get back on their feet, so to speak. Or to put it very simply, it's not society's job to fix the results of the natural lottery. Good things happen and bad things happen through the forces of nature, and it's not up to society to fix those sorts of outcomes. Engelhardt does anticipate that the reader might be uncomfortable with this, and so he mentions it may very well be unfeeling, unsympathetic, or uncharitable not to provide such help. One may face eternal hellfires for failing to provide aid, but it's another thing to show in general secular moral terms that individuals owe others such help in a way that would morally authorize state force to redistribute their private resources and energies, or to constrain their free choices with others. Let's unpack that a little bit. What he's saying is it might be really cold of us to not step in and help people who have lost everything because of some natural disaster or disease or genetic disorder. It might be, as he says, unfeeling or unsympathetic. And so if we want to be a sympathetic person, if we want to be a kind person or a generous person, then yeah, maybe we should step in here. But that's a very different perspective than saying the state has the right to step in and take resources from those who have resources and give it to people who have fallen prey to these sorts of natural disasters. So just because it would be kind or generous or charitable for us to help people who lose the natural lottery, that's a very different stance than saying the state can force us into helping those who have lost the natural lottery. So for Engelhardt, the state doesn't have the automatic right to force some people to help whoever has lost the natural lottery. Bad things happen, and that's unfortunate, but we don't have a state-mandated moral obligation to step in and fix these problems. At least we don't have that sort of obligation prior to our agreeing to create such rights. So if we create a society in which whenever a natural disaster happens, those who have resources will automatically step in or be forced to step in order to help those in need, if we set up the law in such a way that requires that may be fine. But prior to the agreement, prior to coming to some sort of contractual setup, we can't force people with resources to help those who have lost the natural lottery. Or to just put it very simply, Engelhardt says, to be in dire need does not by itself create a secular moral right to be rescued from that need. So just to sum up on the natural lottery concerns changes in fortune that are the result of naturally occurring phenomena, whether disease, genetic disorders, natural disasters, any of that sort of thing, where the good things and the bad things that happen are not the results of human choice. When good things or bad things like that happen just by the forces of nature alone, nobody's responsible for those outcomes, and so nobody's responsible for fixing those outcomes. We could set up society in such a way that when bad things like this happen, those who do have resources ought to step in or are required to step in. But prior to our coming to that kind of agreement, people with resources can't be forced to fix the results of the natural lottery. What this means in terms of healthcare is that some people lose the natural lottery with respect to their personal health. So those that develop cancer early on in life, or those who are predisposed to heart conditions or neurological conditions, those are bad states of affairs. Those are misfortunes that are the result of the forces of nature. But if there's nobody who's responsible for causing those situations, then there's nobody who's automatically required to fix those situations. So these may be tragedies that occur, but nobody's required by the state automatically to step in and fix those tragedies. Or just put very simply, when people lose the natural lottery with respect to their health, it's not the duty of society to fix that result by providing them with health care. Engelhardt also talks about the social lottery, though, and the social lottery is concerned with changes in fortune that are not the result of natural forces, but the result of actions of persons. So, for example, a wealthy relative may leave you a large inheritance, or someone may steal your car. In the first case, that's a kind of positive result, where one individual acquires a great deal of resources through the social actions of others. In the other case, that's a negative outcome, where someone loses a resource because of the actions of others. And so when it comes to the social lottery, where human action influences the good things and the bad things that happen to people, here's what Engelhardt says. An injured party has a claim against an injurer to be made whole, not against society. The outcome is unfortunate from the perspective of society's obligations and from the perspective of obligations of innocent citizens, but restitution is owed by the injurer, not society or others. If someone steals your car, it's the thief's responsibility to give your car back. Or if they destroy it, it's the thief's responsibility to pay for those damages. But either way, the responsibility is on the person who did the action, not on society. So it's not the taxpayer's job to provide you with another car. It's not the taxpayer's job to reimburse you for the damages to your car. It's entirely up to the person who did the wrong thing to pay you back. This isn't to say that society can't have any role to play here, but Engelhardt just says just and beneficent states should try to prevent and to rectify through legitimate police protection, forced restitution, and charitable programs. So society can step in terms of policing these sorts of events, where if someone tries to steal your car, society can step in and prevent them from doing that. Or in cases where somebody does steal your car, society can hold that person responsible for paying you back or for returning your car. But either way, whether society is preventing these sorts of harms from occurring or society is holding the injurer responsible for paying back the victim, either way, it's not society itself that's paying back the victim. Society isn't giving the victim money, or to use Engelhardt's term, society isn't making them whole again. Society is just there to enforce, to make sure that the wrongdoer pays for the wrongdoing. So again, let's just talk about the natural lottery and the social lottery as they apply to healthcare. When it comes to the natural lottery, some people lose the natural lottery. Some people develop disease, some people develop other disorders that impedes or undermines their health. This is a negative sort of state of affairs, but prior to any agreement among the diverse groups that make up society, society doesn't have an obligation to step in and fix that. So even when somebody loses the natural lottery, it's not automatically society's job to step in and provide them with health care. Even with respect to the social lottery, when somebody is injured by someone else, it's not society's job to provide for health care that will fix those injuries. Really, the responsibility falls on the injurer. So if you want to talk about who pays the hospital bills of someone who's been injured, the perpetrator should pay for those bills, not the taxpayer, unless we set up our society in such a way that it's agreed upon that the taxpayer will pick up those sorts of expenses. So just to wrap up on Claim 1 was that a basic human secular moral right to healthcare does not exist, not even to a decent minimum of healthcare. Such rights must be created. All he's saying here is that bad things happen to people in terms of natural lottery, social lottery. Sometimes people need healthcare, but they don't have access to it. And society doesn't have a sort of obligation to fix those problems prior to us setting society up in that particular sort of way. So somebody doesn't have a right to healthcare unless our society decides to provide them with that sort of right. The right has to be created. It doesn't just exist independently of a contractual agreement. This is why Engelhardt thinks arguments that say justice requires that we provide healthcare for all, that's not going to work because, for one thing, that depends on one very specific view of justice, and there's a lot on offer. The demands of justice change based on the laws we put in place. So if there's anything like a universal right to healthcare, that right has to be created. There's no naturally existing secular moral right to healthcare. Moving on to the second claim now, this idea that creation of a single-tiered healthcare system is morally wrong. Engelhardt says this: a two-tiered system with inequality in healthcare distribution is both morally and materially inevitable. Why think that a two-tier system is inevitable? For one thing, people have their own private property. They have their own resources, they have their own savings, and they can do with that what they want in many cases. So people who need healthcare but also have a lot of wealth might use that wealth to make sure that they get the best healthcare. If they can't get it in this country, they might go to another country. But the idea is they're going to continue to use their wealth to try to get higher levels of care in many cases. So there is such a thing as private property, and as long as there's such a thing as private property, people might use that to try to secure better healthcare for themselves. That, I think, is why Engelhardt is saying it's materially inevitable. Think back to Nielsen's argument. So Nielsen was arguing that every individual should have access to exactly the same level of healthcare. He made the argument that this is about equality of persons. If you give one person access to greater healthcare than another, that represents a kind of inequality that we should stamp out. Engelhardt points out, though, that people will want to use their resources to make sure that their loved ones, their friends and family, get access to better care when possible. So suppose you have a loved one who has a serious healthcare need, and you have lots of material resources available that will allow you to travel wherever you need to make sure they get the best care available. Nielsen would say, to do that, to use your resources to get your loved one better care, is wrong. In other words, Nielsen is kind of saying, shame on you for trying to get better care for your loved one. The fair thing to do here is to make sure that your loved one gets equal care to everyone else. By comparison, think about parents and their kids when it comes to education. Some parents might put their kids in private education systems because those offer a better product than the local public schools. If Nielsen's comments on healthcare were applied to education, he would say shame on those parents for trying to put their kids in private schools and get their kids a better education, because we should be aiming to get everyone the same level of education. So on Nielsen's view, this idea that there should be this single tier of healthcare, it's shameful or it's wrong, morally speaking, to try to get better healthcare for your loved ones. This is why, with respect to those who defend a single tier of healthcare, Engelhardt says, these authors have to suppress the widespread human inclination to devote private resources to the purchase of the best care for those whom one loves. Engelhardt is saying it's perfectly natural, and it might even be a good thing, that we try to use our resources to help the people closest to us, to help the people that we love. And people like Nielsen, who say healthcare should occur at a single tier only, are saying there's something wrong with that mentality. There's something wrong with treating your loved one better than a complete stranger. Nielsen and that kind of thinking, the idea of there should be this standard healthcare for everyone, is that you shouldn't treat strangers any different than your loved ones. And Engelhardt just doesn't think that's reasonable. To be fair, Engelhardt proposes a compromise here. He recognizes on one hand the importance of personal relationships. He doesn't want to demolish this idea that we are entitled to try to get better care for the people we love. But at the same time, he recognizes that every person in our society might need a basic level of care. So his proposal is that as a society, we come together and we create a basic tier of healthcare, which provides some amount of healthcare for all, while still permitting that there be higher tiers of healthcare, which are available to those with resources to purchase additional or better services. As a community, as a society, if we want to come together and say every individual should be entitled to the same basic level of healthcare, whether they can pay or not, that's fine, go for that. But at the same time, you can leave intact the possibility that people can get higher levels of healthcare in cases where they have resources and they want to get better care for their loved ones. As Engelhardt puts it, this kind of multi-tier system allows for the expression of individual love and for the pursuit of private advantage, though still supporting a general social sympathy for those in need. We can create a system that takes seriously the needs of people who don't have health care, and we can provide them with a basic level, but that doesn't require that we prohibit people from resources from getting better care. And so again, Engelhardt's point here is that a single-tier system like the one Nielsen is defending must suppress the widespread human inclination to devote private resources to the purchase of the best care for those whom one loves, whereas a multi-tier system can recognize a legitimate place for the expression of such inclinations. The single-tier healthcare system requires that we treat our loved ones and our strangers in the same way. The multi-tier system says, let's do our best to take care of the basic needs of the stranger, but at the same time, don't prevent people from trying to do better for their loved ones. There's nothing wrong with treating your loved ones in a better way than a stranger. Or put differently, there's nothing wrong with spending more money on caring for your loved ones than the money you spend caring for strangers. So wrapping up Claim 2. Claim 2 is this idea that a single-tier healthcare system is immoral. There's two reasons that we might cite for this sort of conclusion. One is that people have their own resources. There's an inequality of wealth, and people have the right to use their resources as they see fit. If someone wants to use their resources to buy better healthcare, that's their right. But secondly, the single-tier system penalizes people who might want to use their resources to help their loved ones get better care. In other words, the single-tier system and people like Nielsen who defend it are telling you you shouldn't be spending more to take care of your loved ones than what you spend on taking care of strangers. And Engelhardt just rejects that kind of thinking. From his perspective, he thinks it's perfectly reasonable to spend more of your resources, your time, your energy, your money, taking care of the people you love, rather than complete strangers. Now, one last comment on healthcare systems as discussed by Engelhardt. He mentions that it's fashionable to affirm an impossible commitment in healthcare delivery, as, for example, in the following 4 widely embraced healthcare policy goals. In other words, here are 4 goals for a healthcare system that Engelhardt thinks are really popular. First, that the best possible care is to be provided for all. Second, that equal care should be guaranteed. Third, that freedom of choice on the part of the healthcare provider and consumer should be maintained. And fourth, that healthcare costs are to be contained. So the 4 goals of healthcare that are fashionable. Everyone gets the best care, everyone gets equal care. Everyone has a free choice, whether the patient or the doctors themselves. They have choice about the type of care to receive or to pursue. And finally, all of the costs of this process are contained. They're limited. Engelhardt thinks that these 4 types of goals are very popular. They're the kind of thing that people will love to hear. But at the same time, it's literally impossible to make sure that all 4 of these goals are met. So take, for example, the first and the fourth goals. Engelhardt says one cannot provide the best possible healthcare for all and contain healthcare costs. If we provide literally the best care for everyone, every type of procedure, medication, treatment that could possibly benefit them, just the very best for everyone, that means spending money on doing everything. So you do everything for everyone, that will cause expenses to go through the roof. There's no way that you can do the literal best job for everyone and at the same time save money. Regarding the second and third goals, Engelhardt tells us one cannot provide equal health care for all and respect the freedom of individuals peaceably to pursue with others their own visions of healthcare or to use their own resources and energies as they decide. So the second goal was to give equal care to everyone, and the third was to make sure that people stay free in terms of the healthcare they want to pursue for themselves. You can't do that because if everyone gets equal healthcare, they all get the same package or product or services, then that restricts people's freedom to go out and pursue what healthcare they want for themselves. Some might use their freedom to seek out better healthcare than is average. Some might use their freedom to seek out worse healthcare than is average. But as soon as you start allowing people the freedom to make choices about their own healthcare, now you've eliminated the equality condition. Now the healthcare they're receiving is unequal because some people choose more than others. Regarding goals 1 and 2, Engelhardt says, one may also not be able to provide all with equal healthcare that is at the same time the very best care because of limits on resources themselves. This becomes extremely clear when we talk about scarce resources. So if you have 100 people who need a heart transplant and the best medical care is that they receive a heart transplant, it's impossible to treat these individuals equally. You can't give them all a heart transplant. So if you treat them all equally in a literal sense, you could give none of them a transplant, but that's not giving them the best. So it's not possible to treat them all equally and at the same time give everyone what's best because we have finite resources. We don't have an infinite number of organs for donation. We don't have an infinite number of hospital beds or medical supplies or physicians. It's just not possible to give everyone the literal best healthcare available and give everyone equal treatment. There aren't enough resources to go around to pull that off. You might even think of this in terms of providers themselves. So take the very best neurosurgeon in the world. If everyone gets the best possible care, that means the best neurosurgeon in the world provides that care for everyone. And that's not possible. There's too many people who have a need. So we either give up equality and let some people get the best care whereas other people don't get the best care, or we give up the goal of getting everyone the best care. The point here is just you can't give everyone the best care and treat everyone equally. All this to say then, when it comes to healthcare systems, when it comes to proposals that people are putting forward, we need to look really carefully at what the goals are and whether those goals can be realized at the same time. If we have a list like this, where we have 4 goals that all sound really good, we have to test to see, is it even possible that all 4 could be realized at the same time? When constructing a system of healthcare, we should be realistic, not just about the goals that we can accomplish, but realistic about the resources we have available as well. And that will help shape our policy. Now, once again, this is not about endorsing a particular view. This is not to say that Engelhardt's right about any of this stuff. Each of the arguments we presented here, there might be serious flaws with. Each of the challenges to healthcare systems that Engelhardt presents, there might be serious flaws with those too. Nielsen might be able to come up with lots of responses to what Engelhardt has said. But the point is, these are just various perspectives and challenges to keep in mind as we're not only trying to construct healthcare systems that are going to help as many people as possible maybe, but when we talk about healthcare and justice, it helps us to keep in mind that we might not be seeing eye to eye with others in terms of what justice is or what justice requires. So it's an invitation to get clear not just on those terms and the moral foundations that we're relying upon, but finding ways that people of lots of different worldviews can come together and create a healthcare system that works for people. So again, these are just challenges to keep in mind as we're trying to build healthcare systems, as we're thinking through what justice requires and what it doesn't. But all that being said, here are some resources available if you want to keep reading about healthcare systems, or especially justice in healthcare systems, what a just healthcare system might look like according to different worldviews. This is just a list of resources you can check out if you want to keep reading about that stuff.